Hey everyone, my name is Jordan Ridge and I'll be presenting the bicep tendon tear injury. So, what exactly is this injury? Well, it's a strain or tear in the bicep muscle that occurs in either the shoulder or elbow. So, it can be a complete tear where the tendon's completely torn away from the bone, or it can be a partial tear where it's just partially torn away. Now, this can be classified as either grades 1, 2, or 3, just depending on how severe of injury this is. So, your grade 1s are going to be your minor injuries that involves overstretching the bicep muscle or tendon, and this typically results without a loss of strength or mobility. So, you still have your strength or mobility, but you're going to really feel that pain in your upper arm. Now, your grade 2 is where you partially tear your muscle. Now, this um, will result in some loss of mobility or strength. And then your grade 3 is going to be your complete tears where you really don't have any strength or mobility left in your arm, and this may require some surgery to repair it. Now, what are the risk factors? So, some high risk factors are going to be your athletes in sports with a throwing motion. So it's going to be your baseball, softball, volleyball, football, any sport that requires that throwing motion. It's going to be those athletes that are going to be at higher risk. And if you participate in like heavy lifting competitions, like your weightlifting, CrossFit competitions, that's going to put you at a higher risk as well. Now, more risk factors are going to be some poor circulation or poor blood flow throughout the body, if you've had a previous shoulder or upper arm injury, and really just not stretching before you participate in those sporting events, or if you participate in those weightlifting competitions, or just really not even stretching before you go to the gym if you're going to be lifting some, doing some upper arm exercises. Not stretching will put you at a higher risk factor for the bicep tendon tear. Now, some causes of this injury include just like lifting a heavy object or something as simple as falling on your arm. So you can see in the picture to the right that this guy is at a weightlifting competition. You can tell that he is obviously lifting a very heavy object just looking at his bar bending, and you can tell by all the weight on his bar that will cause the bicep tendon to tear, which you can see that his did with the red circle. Um, it shows that his bicep is kind of projected out of his upper arm. Another really big main cause is just the overuse of the tendon. So your bicep tendon muscle is just going to wear down over time. So as you get older with age, your bicep tendon may be more easily to tear. And then also with sports, overusing the tendon. If you're continuously using it like a baseball pitcher, they pitch so many balls every inning throughout the game, it's going to cause them to tear their bicep tendon a little bit easier. Now, some symptoms that go along with this injury may include feeling a pop in your arm, or feeling that warmth around the injury and getting that swelling, the bruising in your arm. You can see it in the picture to the left, and having the pain throughout the arm and getting arm weakness, trouble moving or rotating the arm. That's going to be some symptoms. And having the fatigue in the arm, and like I said before, the bicep projecting from the arm, that's going to be able to tell the doctor that yes, you did tear your bicep tendon. Now, if you are starting to feel those symptoms, then you might want to go see a doctor right away. And once you see the doctor, they're going to go through those physical exams. So they're going to ask about your medical history, if you drink, smoke, if you've had any previous injuries before this. They're going to go through all of it, the regular routine that you go through when you go see a doctor. Then they're going to ask about those symptoms. They're going to see if you did feel a pop in your arm, or if there's bruising, swelling, if you have that projected bicep in your upper arm, to help them better diagnose if you did tear the bicep tendon. Then they're going to look at some physical tests, and one physical test that helps diagnose the bicep tendon tear injury is the hook test. And now in the picture to the right, you can see the doctor performing the hook test, but on the next slide, this doctor helps explain how to perform the hook test.
With United Healthcare Medicare Advantage plans, you can take advantage of $0 preventive dental.
Conduct the test, the patient is either standing or sitting. Then the patient is asked to actively flex the elbow to 90 degrees and to fully supinate the forearm. In case of the right elbow, use your left index finger and try to hook it under the biceps tendon by bringing it in laterally of the antecubital fossa. In a normal tendon, you should be able to hook your finger under the tendon approximately 1 centimeter or even until the distal interphalangeal joint and be able to pull it forward vigorously. If the distal biceps tendon is avulsed, you won't be able to hook your index finger under the tendon, which indicates a positive test. In a second scenario, pain may be elicited when pulling the intact tendon forward, which may suggest a partial tear or other injury of the tendon or sheath. Alright, make sure.
Okay, you can see how that video really helped explain how to perform the hook test. Now, the hook test isn't the only physical test a doctor may perform. They're also going to perform other physical tests to make sure you didn't injure any other part of the shoulder. They're going to make sure that you didn't injure your rotator cuff, or if you didn't have a shoulder impingement, or if you don't have like shoulder tendonitis. They just want to make sure there is no other injury that goes along with the bicep tendon tear, so they're going to perform other physical tests other than the hook test. And the doctor may even order an X-ray and MRI just to make sure that there are no other problems with this injury. Once the doctor does diagnose the patient with the bicep tendon tear injury, they're more than likely going to recommend the patient to treat this injury non-surgically. So they're going to recommend the patient to rest. They're going to recommend them to just ice, take anti-inflammatory medications, and even go through some physical therapy. Now, physical therapy is going to be a key factor in the recovery process because the physical therapists are going to take the patient through strengthening exercises and stretching exercises to help that muscle gain the strength back, gain the range of motion back, and just really help the pain go away and get you to feeling as normal as possible. The doctor will also recommend the platelet-rich plasma therapy. And all this is a therapy that's going to speed up the recovery process. So the doctor is going to inject this concentrated growth factor platelet back into the injured elbow or injured shoulder to help with the blood flow and blood circulation at the injury site to speed up the recovery process. Now, if the patient has just chronic pain in the upper bicep and nothing is really helping, the doctor will recommend them to have surgery to get their bicep tendon repaired. And the doctor may even recommend surgery for people who need their full range of motion back. So that's going to be your athletes who want to continue participating in their sport. The doctor will recommend for them to receive surgery, but that is a more rare case, and people with the bicep tendon tear injury usually treat their injury non-surgically. Now let's look at the rehabilitation process. So the doctors are really going to gradually work through strengthening exercises, and they're going to harp on not participating in any activities that could injure the arm more, just because they don't want you to go back to the beginning of the recovery process just because this is such a vigorous process. So for mild injuries, the timeline for getting back to your normal strength, or as close as your normal strength and range of motion as possible, will take about 10 weeks or more to recover. And then your severe injuries that need surgery are going to take a few months to recover from. So after surgery, the doctor and the physical therapist are going to require you to wear a sling for about 4 weeks. And they're going to gradually take you through those strengthening exercises and work your way back up to get as much range of motion as possible. Now, the timeline of the recovery process does vary with the age of the patient and their health background, and like I said, the severity of the injury. Now, there are ways to prevent this injury. And so some tips include doing the strengthening exercises and really strengthening your upper body muscles so you can prevent tearing your bicep tendon. And then next is avoid overusing the shoulder as much as possible. And I know this is a little bit more difficult to do, but if you do participate in those sports that require that throwing motion, just make sure you are stretching before and doing everything that you can to take care of your arms so you can prevent the bicep tendon tear injury. Then some other prevention tips include not smoking and not using steroids, because steroids can really weaken your muscle and weaken the tendon, which may put you at a higher risk factor of tearing your bicep tendon muscle. Now, I hope you can take these prevention tips and apply them to your life so you can prevent yourself from tearing your bicep tendon muscle.